Good afternoon, everyone. It is 1 p.m. here, and so we're going to go ahead and get started to allow plenty of time for the presentation and questions. I have started recording the webinar so that it will be available later when we put it on YouTube. So again, thank you all for being here today. And let's get started. Let me go ahead and start to share my screen. Okay, great. If you can't hear, or obviously you wouldn't be able to respond if you couldn't hear, but here are the instructions if you need to adjust your audio. We will be, actually I need to turn on captions. Let me do that. We will be using captions, and you can turn them on and off as you need to. Actually, I won't turn them on. I'll let you turn them on if you need to for yourself. And then we will be sharing this audio later on YouTube, and you'll be able to watch this recording if you have to leave early today or know someone who missed it and that they need to catch up on this webinar. So first, I want to tell you a little bit about who we are. My name is Faith Steele, and I'm with the National Network of the Libraries of Medicine, Region 1. If you're not familiar with us, we'll go over here a few minutes to tell you about who we are. We'll also be using chat for the questions today. So if you have any questions, feel free to chat them anytime during the presentation. We will allow time at the end for any questions. So we should have plenty of time. Feel free to put them in at any time, and we will make sure that we get your question recognized. So who are we? For NNLM. Well, this picture here, if you can see, it will show you that NNLM is a program of the National Library of Medicine. And the National Library of Medicine is the world's largest biomedical library, and they are an institute of the National Institute of Health. So how we do our work through the NNLM is through regional medical libraries, like I mentioned, with Region 1. So I serve all of the states here in the light blue. If you're located in this state, then I would be your representative. If you're not, then you have a representative or an office that represents you in one of these parts of the country. We also represent Puerto Rico, the Virgin Islands, and Alaska and Hawaii as well. So there is an office for you. If you're not sure if you're served by the United States, please reach out to us and let us know. And I'll put that link to the NNLM in there so you can find your region. So how do we mainly do this thing? Well, what we mainly focus on is training, access, and funding. So we offer free webinars, such as the one that we're doing today, and classes to librarians, health professionals, and the general public, anybody that's interested in the topics that we're doing a webinar on. We also offer access to a network of libraries and other organizations. So your organization can join us as a member, as a network member. It is free, doesn't cost you anything. And you can get support for us as far as if we're doing webinars, if you want to reach out to us, ask us questions. The last bullet here that we talk about funding. And so we do have funding available for eligible institutions. They're on a variety of topics depending on the regional medical library from year to year, usually in the areas of health information outreach, digital equity, data services. Sometimes there's even monies available for professional development. So when you see those funding calls out for your region, once you identify what region you're in, you can reach out to them and find out more information about their funding opportunities. So for today's agenda, we are going to be describing the partnership between our featured speakers, which is Anne Arundel County's Public Library and Anne Arundel County Department of Public Health, with the shared aim to talk about their collaboration on preventing gun violence. We're going to explain the process and resources for establishing a gun lock distribution program, and then we're going to discuss programmatic measures and lessons learned from the program. So I want to introduce our speakers today. We have Dr. Toni Gedden for the Health Officer of the Anne Arundel County Department of Health. She's responsible for guidance and direction for public health programs affecting the county. These programs can include disease prevention, environmental health, behavior health, school health, and family health. She assesses community health needs, plans and develop programs, enforces the county and state laws and ordinances, and acts as the spokesperson for public health issues for the county in coordination with the Maryland Department of Health. She serves at the pleasure of the appointing authority. And for more information about Anne Arundel County, you can find them at aahelp.org. We also have with us Gloria Harbitz, who works for Anne Arundel County Public Library. She is the regional manager for the system. She also has managed 2 capital projects, including opening a community library, the Maryland City at Russet, which is a very lovely library. I used to be one of my branches, one of my favorite branches. She also worked on the Michael Bush Annapolis Library, another beautiful library that just recently opened in Annapolis, Maryland. And she also organized the library's first COVID vaccine clinic in partnership with the Department of Health. She serves as a representative on the county's gun violence intervention team since started in 2021. And she's also passionate about public libraries and their communities they serve. She earned her bachelor's from the University of Maryland and then her library science degree from Catholic University. She's also a graduate of Leadership Anne Arundel. So I first want to thank you both for being here today. So excited and looking forward to this since it is Gun Violence Awareness Month. And we're looking forward to hearing what you have to say. So thank you so much for being here. And just let me know when you need me to advance the slides.
Okay, Faith, thank you so very much for the warm welcome. Dr. Gedd and I greatly appreciate this opportunity to share information about our experience with providing locks at the library and increasing community access to safe storage. As you mentioned, June is Gun Violence Awareness Month, and I just wanted to share that the Department of Health and the Anne Arundel County Public Library are the first in the state of Maryland to provide gun safety locks for residents. So it's the first of its kind program in the state. Other public libraries in the country, a few other, about 13 at the time, were providing the locks, but in partnership with other organizations, police departments, Moms Demand Action, etc. So this is a unique partnership, and I think it's one that can be replicated easily in other jurisdictions. If you'd like to advance the next slide, please. You've already reviewed the chaining objectives for today, so I think we can advance that slide as well. We wanted to provide you with a little bit of context about where Anne Arundel County is. We've got a county map here on the side, and on the left, you can see that we are nestled between our state's capital, Washington, D.C., Virginia, and then to the north, Pennsylvania, New Jersey, Delaware, New York. And in our county, in Anne Arundel County, we have 16 library locations. We have a lovely mix of urban, suburban, and some rural areas as well. Our county consists of 580,000 residents, and the operating budget for the library is approximately $33 million. We are independent from county government. We are not a department of the county. However, we are reliant on the county for funding. Next slide, please. And Tony and I are going to provide you with an overview of each department. Some numbers, we always talk about numbers in library land. So for the library, our cold card holders represent 57% of county residents, which is a pretty good statistic. We provided in the past fiscal year 6,491 programs and had an attendance of 222,563 participants. We've had 1.5 million branch visits to our libraries, 3.1 million website catalog visits, 5.4 million items that have been used. And again, we have the operating budget. This one is roughly $33 million. We have about 300 full-time equivalent employees. So that's an brief overview of the Anne Arundel County Public Library. Next slide. And now Dr. Gedden will take over with the Health Department.
Hi, everyone. Thank you for joining today. So a little bit about the Department of Health for Anne Arundel County. We have just over 800 employees, and we're broken out across 5 different bureaus that you see listed here, including administration. And as Faith mentioned, we have a wide variety of health topics and concerns that we address for the county. And here's a little bit about what we're working on from our strategic plan priorities. We can move to the next slide, please. And then there's the background for gun violence. One other thing I'll mention is Gloria talked about this as well. Our operating budget for the health department is about $93 million, and that's a mix of state, county, and categorical grants that fund us. And I'll hand it back to Gloria to talk about the background for this, because she was here in 2018 when these things started to happen. Oh, you're on mute, Gloria.
I'm sorry. So unfortunately, we did have a mass shooting here locally in Anne Arundel County in 2018. And our county executive came up with the idea to have a task force to address gun violence in our county. So we had the health department formed the gun violence intervention team, and there have been ongoing quarterly community meetings to hear directly from residents about their thoughts for solutions, what they're experiencing. And we all know that each community is very different in their experience with gun violence and really any social issue. So it's important to the health department and the library to hear directly from the residents about what they're currently experiencing. We have the historical perspective as well, but it's so important to be able to pivot to provide options of things that are needed currently for the community. And then the health department did a release of their strategic plan after it was developed to the community.
So I'll touch on, what does it mean to have a public health approach to gun violence? That task force specifically looked at where this gun violence intervention team should sit within county government, and deciding to move it not necessarily away from public safety, because public safety is definitely a part of the work that we do, and they are members of the group, but to look at what a public health approach could mean. So evaluating the problem, utilizing statistics, so having a data-driven approach, assessing the local needs and understanding the local challenges around gun violence, including both suicide and homicide. Developing best practices and understanding what were evidence-based practices that we should be implementing to address gun violence, and then how do we widely adopt effective strategies? So being able to actually implement and then measure the success of what we're looking at. And so some of this for us is treating gun violence and understanding that we need to treat gun violence similar to that of disease spread, right? That we can identify who is high risk, that we can disrupt transmission, and knowing that gun violence moves in similar patterns. So the things that we do in public health to address disease states are also effective in addressing gun violence. Next slide, please. So this is a little bit about the Gun Violence Intervention Team, or you'll see it listed as GVIT, and who we are. So there are just over 52 members, and it includes a number of folks throughout county government. So we have, as Gloria mentioned, she's been a member since the beginning. So libraries, the school system, public safety, so that includes fire and police, the Office of Law. There are a number of other members that work with us. And this is where you can find more information on our websites about who we are and what we're up to. Next slide, please. All right, so I think Gloria is going to take this one, because this was her brainchild, which is what she will not take credit for a lot of times when we talk about this, but how we actually came up with this idea was a suggestion from Gloria.
So thank you, Tony. So actually, the quarterly meetings I mentioned a few minutes ago, the health department provided a community meeting in June 2021 or 2022, excuse me. And during that meeting, one of the vendors present were our local police officers, and they had the gun safety locks available. And at the end of the meeting, I went up and talked to the officer and said, "What do you have here?" And he said, "We've got gun safety locks for free. Please take as many as you want." It was as big as a copier box that has copier paper in it. And I was the only person who took the gun safety locks, and with good reason, probably. Um, the library is a trusted partner in the community. Not saying that the police aren't. They have a different role to play. The officer has a badge, he has a gun, and he had a body camera. And I actually admit that I thought to myself, ooh, am I going to be on camera? I guess I am, to get this gun safety lock. So the very next day, I talked to the chief operating officer of the library system, Kathy Hollerbach, and said, "What do you think? I think the library could easily distribute these to the community and be very effective." So I reached back out to the health department, Bella Young, the contact at the time for the GBIT, and offered to do this for the community. And so having this launch day was the brainchild of Megan Pringle and Christine Feldman, the two communications directors for both departments. And as you could see on the left-hand side, Megan was able to get just about every news station in Baltimore to come to Annapolis for this launch. And on the right-hand side, you'll see that it really does take a dedicated village of community leaders. We've got Dr. Gedden at the podium. We've got Dr. Bedell from the school system, Skip Auld, the CEO of the library, our local police department, both city and county, along with Moms Demand Action. And then Dorothy, somebody who was impacted by gun violence at both as a child and then in her own life as an adult with her son who took his own life by gun. So that launch day was huge in getting recognition and the messaging out about this new service. This was kind of a different service for the library to provide. You think of the library in traditional ways, and this is kind of was a different approach. So this was a huge, it was a huge way to get the message out about the resource in the community. And as you also notice, we had a sign language interpreter available as well. Next slide, please. So communications. On the left-hand side, you'll see this cute picture of Welby, the Department of Health, little Jude, who's got a gun safety lock with him. And communications and continuing to provide that messaging about this resource to the community is huge. We've got a couple of best practices listed here on the right. Getting feedback from your PR and comms department is crucial when you're launching any initiative. They have the resources, networking in place, and can look at it from a different lens than either practitioners from the library or the health department. Involving government officials, as we did with the launch. Acknowledging that every community is different is just key. I probably should have led with that, actually, because every community is experiencing different issues every day. So you've got to look at what you can do in your community and what resources that you have. In our community, we're lucky to have a group called the Partnership for Children, Youth, and Families, and they produce a report called Poverty Amidst Plenty. And we get a lot of data from that and a lot of insights that help inform the programs that we provide at the library, and I'm sure with the health department too, with the initiatives that they provide and that we pursue. We also acknowledge the importance of social media and local media outlets. Dr. Gedden gave an amazing interview, I think it was Channel 11 TV in Baltimore, to share that healthcare lens of why providing gun safety locks, and that is kind of low-hanging fruit to start to address the gun violence issues that we're seeing in our communities, but you have to start somewhere. And so this was a really good thing to do. So these are some of the takeaways that we have with implementing a program like this. Next slide, please. Okay, so with gun lock distribution, one of the things that we do with the Department of Health that was very different for us for the library is that we had an intake form to learn information about who we're providing locks to. And also it helps to inform where we go from there. Who are we reaching in the community? Where are we reaching them? How are we reaching them? So in this particular slide, you'll see how people are being notified. I love the fact that word of mouth by finding out about word of mouth and also social media are the same at 10%. But I also noticed that at email and library announcements are each at 22%. That's pretty significant. You'll also see on the right-hand side that 28% represents other ways that community members have relayed to the staff how they found out about the initiative and the resource. So we had ginormous signs in the library, 22 by 28, and that was something that customers reported, or also outreach events. It's a huge way that we reach customers in the community and share resources about a variety of things. Library website, and some unexpected local sharing. Local gun shop, ring security camera was also something that we found that was interesting, that there was a notice that went out to the community that way and customers shared that as well. And also our school partners with the Anne Arundel County Public Schools also shared resources and updates about this resource with their community. Next slide, please. And I just wanted to share with you a couple of charts that depict how important that messaging is, that when you send it out. What the charts show, 1, 2, and 3, is that every month where there is an orange star, that's a month where we had communication that was sent out by the library, by the health department. And you'll see that in April of 2023, just in that 2 short week period, we were able to distribute 949 gun safety locks, 2 weeks. In talking with our partners, another library system, a sister library system in another state that also participated in this type of initiative, said you would be lucky to give out 50 gun safety locks in a month. And so, to be honest, at the 3 pilot branches, in distributing nearly 1,000 in the first 2 weeks was a little overwhelming for us. And it was very eye-opening about, we have really struck a chord in the community that's being served. So it's been a resource that's been well appreciated by our customers and residents. You'll see that every time that we have a message sent out, we have at least 500 gun safety locks that have been picked up by residents. And a great example is down at the bottom on chart 1, where in December 2023, you'll see that there were 15 gun safety locks issued as of December 7th, in the month of December. A message from the library went out on the morning of December 8th. And then the health department also had that WellBe message that went out at the end of December, which resulted in 589 gun safety locks being issued for that 1 month. Fast forward to chart 3, in the month of April. As of April the 12th, we had 59 gun safety locks that were issued. The library sent a service spotlight about the resource being available. And again, you will see that we reached 512 gun safety locks that were issued that month. So I think this speaks volumes about the value of one message and just sharing it as much as you can to reach the population and your residents in your community. Next slide, please. And Tony, I think this one's yours.
I'm going to touch on what gun lock distribution looks like. So we started with the public libraries, as Gloria mentioned, as our initial partner, because this was her wonderful idea. But then we quickly figured out that we needed to expand how we were getting them into the community. So in some meetings with various partners for all sorts of different reasons, either people would bring it up to me, or I would be giving them updates about what we were doing as a health department. This would come up and folks would say, we'd love to give them out on your behalf. But what we also found when you look at this chart is that we were reaching more minority populations, so people who identified as Black or Hispanic, in community settings, right? So not necessarily in our libraries, but we could reach them at some of the events that you see listed above. And so starting to partner with community-based organizations, also with our Department of Social Services, the community college, and within the health department, right? So at our health centers and our Healthy Start teams that are going out doing home visits with families, they've started distributing gun locks. And so far, so good, right? We've really seen that people, similar to what we saw in the library, and it was very helpful for us to be able to say, this is the response that library staff are getting from the public. This is what we've heard. This is how to approach this conversation. We know that guns can be very controversial. And so it's been important that we talk about this as a safety measure. And that's helped a lot in those conversations. So informing partners of how to have that conversation, really keeping it simple. If you have a firearm in the home, is it safely stored? Is really about all it takes to get to this. And so we've expanded to the other partners that you see listed here, and very excited to continue thinking of ways to get the gun locks out into the community. The libraries, of course, are our biggest partner and give out by far the most gun locks. But I definitely think we're reaching other populations and other people who may not be going to the libraries or who aren't receiving the communications and thinking, I'll make the time. We're trying to take it to people wherever they might be. Next slide, please. So where are the gun locks going? As Gloria mentioned, for us as a health department, we're always tracking where we're seeing trends. So what we didn't mention initially is that we decided on the branches to start this project in based on the data that we had around where we were seeing more gun violence incidents. Obviously, the pilot grew very, very quickly to all 16 branches, but it's helpful for us to know where residents reside that are coming to receive these gun locks. And so Annapolis zip codes have received the most gun locks. You can get, and most people come in and get 86% of folks who are coming through the door are getting 2 gun locks. You can get 2 per day. So if you have more than 2 firearms, you can come back another day and get more. We don't require that folks give us an ID. We do ask that you be over the age of 18, and we ask for your zip code, race and ethnicity. And so far, people have not been hesitant to give us that information. And so this is the zip codes that we've distributed through April 15th of this year. And as we mentioned earlier, approximately 5,000 of those, and Gloria has the exact number, almost always updated to tell you exactly where we are. Next slide, please. So again, we do a lot of these sorts of maps in public health, right? Looking at distribution so people have a better, when you show zip codes, people tend to know their zip code, but you may not know what that means otherwise. And these maps tend to help people understand, oh, the northern part of the county, or I think Glen Burnie is here. And so we can now align this with other maps that we use to show where gun violence is happening and to understand that we are distributing these in some of the places that need them the most. So in the dark blue areas, this is where we've distributed more gun locks. As the color gradient gets lighter, this is where we've distributed less gun locks. And then the stars outline where each of the library branches are. So you can understand, for libraries, for us, are a wonderful partner because they provide geographic diversity in locations that we as a health department, we don't have this many locations. So this is really helpful that they are able to provide this. And also, just for context, for those of you who have never been to Anne Arundel County, from end to end, you're looking at about an hour drive from the southernmost part of the county to the top. So if you're saying to folks that live in the southern part of the county, which is less densely populated, to drive to a more densely populated area, they may be looking at a 30-minute to an hour drive to pick a gun lock up. So having these libraries who are in neighborhoods and local really helps a lot. Okay, next slide, please. All right, I'll hand it back to Gloria.
Okay. We've got a couple of comments here on the screen from our community. These are real comments that we have heard from customers, staff have heard from customers who are coming in to pick up the gun safety locks. Also, we have a visual of what the gun safety lock looks like, and it comes with 2 keys, which is a good thing to have. So I think the biggest thing that we saw, people coming in to pick up the gun safety locks by far were grandparents, which was a real shocker for all of us. Um, we often heard, oh, my grandkids are coming to visit soon. This would be fantastic to have in place. We've also heard from customers who have inherited guns and they don't quite know what to do with them. They've come across, this resource in their parents' house that they didn't realize was there. And so they said, at least this will help to keep it safe while they're deciding what to do with the guns. So these are just a few of the comments that we have heard from the customers, but really customers have just loved this initiative and have been very grateful. We were a little concerned. We weren't sure, staff were not sure about how this was going to be received with the community and were we going to hear resistance. As Dr. Gedden mentioned, certainly gun violence can be a tough topic, but I think approaching it from the healthcare lens and talking about this as a safety measure made a huge difference. We heard a lot of comments from people who said, I am a responsible gun owner. I have a gun safe. But this allows me to have a lock in my house too, to keep a gun in a safe location as well. So it's very interesting to hear the comments that customers share. I think the other thing about the gun locks that's very interesting is that, you could get this on Amazon for just a couple of dollars. It's $5.99. But making that resource free and accessible to residents and meet them where they are, whether it's in the library or at the outreach events that we attend or other partners in the county, has just been huge. Next slide, please. So as we were approaching, looks like the top part didn't come up. As we were approaching the 1-year anniversary of the Gun Safety Lock Initiative, April 13th, I thought it was a good idea to touch base with our staff and hear their thoughts about what do you think about this initiative? What would you say to other libraries that are interested in starting this type of an initiative in conjunction with their health department? So on the screen, you will see that we have a lot of wonderful comments here. Again, about the children. The one comment that really strikes and stands out to me is helping people fill a need easily and without judgment or cost. So our staff really feel like they were making a difference in the community. And the thing that sometimes you really just don't know what strikes a chord with people that you work with, people in your neighborhood, people that your circle. And the thing about this initiative is that I have heard from so many of our staff in the system, in the library system, that have been personally impacted by gun violence, whether it was an accidental shooting, a suicide, whatever it happened to have been, and in a variety of communities as well. So really, this struck a chord with our staff too. And honestly, it was something that I was a little concerned about. I was not sure how well this was going to be received by staff, but they look at it as another service that we provide to our customers, to the residents of the county, and that we're trying to keep people safe. So this was wonderful to see and to hear. Next slide, please.
So funding, we knew this would be an important question. I think whenever anybody's excited about what's happening somewhere else and you're thinking about how this could be done where you are, how much does it cost? And as Gloria mentioned, trigger locks are relatively inexpensive. There's a couple things to consider. I know I saw in the chat, someone asked, how do they work? We have a video for staff and for residents. And we have had the police made that video for us with a training weapon to show how to lock it on, but it's truly just a lock that opens up, you click it closed and you turn the key. And so there are other ways to put guns, have them safely stored. Boxes, etc. Those are very expensive in comparison and heavier from a storage standpoint of like, where are you putting these? And so trigger locks, while people say, well, if you get a bolt cutter, you can cut them off. Yes, there are ways around it, but we see this as a risk reduction methodology, and it is, for the way that we're giving them out, really the most practical way. Taking gun safes or larger boxes out to outreach events is very difficult. So That's just one note, but we were able to, from the health department standpoint, because we have the gun violence intervention team, we applied for a grant with the Maryland Governor's Office for Crime Control and Prevention. And we were awarded a grant, and so we've cost about $10,000 a year, roughly for year one. Other costs to consider: communication, so printing things, printing off rack cards to help inform residents on the gun locks themselves, having support from the staff members, right? There is staff time included in this, both on the library side and the health department side. And our internal to the health department, prior to 1 month ago, there's truly only one person whose title is gun violence, right? So there are a number of us who work on it, but we don't have a huge staff that are dedicated to the gun violence work. So I think that's important for folks to understand. Now we're up to 2, which is very exciting. And the vendor is listed here as well if folks are interested. But these are just some things to consider if you're interested in implementing. I think the cost, given the level of impact and the number that we've been able to give out, it's a relatively inexpensive program. It doesn't take a whole lot to get it set up. I think once the buy-in is probably the most difficult part, right? Talking to all the folks that you need to talk to say, we want to do this, and getting everyone on board. The actual implementation, I can speak at least from the health department side, was not that difficult, right? I think we had systems in place, and we were fortunate that we had partnered with one another throughout the pandemic. The library was giving out at-home test kits and masks and other supplies provided by the health department. So we'd also figured out how do we distribute items to the libraries? How do the library systems let us know when they're out of something? So we had some of that infrastructure kind of already in place. But I will say, because libraries are really, really wonderful we move materials from branch to branch, that they had a lot of that infrastructure ready to go already. And they could tell us a lot of what we needed. So this is generally what it takes. If you've got some folks willing to do it, it's relatively inexpensive. Next slide, please. And so partnerships are key. As we've mentioned throughout, there's obviously the partnership that we have with the library system, and we absolutely love working with them. But also thinking about the school system and DSS, as Gloria mentioned, our local management board, the Partnership for Youth and Children, other faith-based groups and community organizations, and then partnering with your local government, right? So the county executive's office, the mayor's office, making sure that they understand what you're doing, your county council or whoever your elected officials happen to be, those partnerships help as well. And making sure that you're able to have a successful program. Next slide, please. So some best practices, and I think Gloria and I are gonna tag team this one just a little bit, because it just depends on, which side of the coin. As she mentioned, PR is so key, and having great comms teams we cannot say enough about how much they've done to make sure that the public is aware of it. Programs like this are successful because people know they can come and get the resource, right? We could have all the gun locks we wanted and all the infrastructure in the world. If no one is aware and asking for them, then we are still missing the mark. Prepare a tracking tool to monitor supplies. I'll let Gloria talk about what that looks like on their side, and then I can tell you a little bit about the form, because I think that was also a question in there, Gloria, what we're tracking and how we're tracking it.
So the form that we have is very basic. It was developed by the Department of Health. And on my end of it, at the library end of it, I'm responsible for the supplies that are issued to the library. So I sign for all the supplies that I receive, and because we have to have tracking for that. And so there's an Excel spreadsheet, very simple, right? So we have it by branch, by month, by day. And for each branch, we have a lead. At each branch, we've identified, the branch manager has identified a lead. It's generally themselves or an assistant branch manager or another staff member. And they send the completed forms to me after they've reviewed them at the branch, and they've input them in the branch, and I just review for accuracy and set them aside for the health department. It's very easy. Excel spreadsheet. Easy. We want to make it easy. But that way we can track trends and see how many we're issuing in a particular month. And when it gets a little low, we can reach out to our comms department and say, whether it's the health department or the library, we need some messaging.
And so on our side, we pick up the forms, right? And we use those forms no matter who the partner is. So when we've started to engage new partners, letting them know that there is a form and data collection, you'll see the library staff member here filling out a form. It takes less than 2 minutes, probably even less than 1 minute, quite honestly. But then on our end, we collect those and we pull the data together, and then we're able to report out on where the gun locks are going, who is getting them, which zip codes, along with the things that Gloria collects on which branches, right, have given out what number. So we have zip codes as well as branch data, and that's really helpful for us.
Actually, Tony, just to add on to that just for a moment, one of the insights that the circulation supervisor shared at the library is it takes less time to complete this form than it takes to get a library card. So that's really interesting insight if you're looking at the library side of things.
Something else that we did was developing an FAQ about the gun locks and providing training. So we wanted to make sure that the staff at the libraries had some of those basic questions available to them and answers for what this meant. Also, one of the things that they were really clear about and putting signs up is please don't bring your weapon in for a demonstration. You will not, the library staff will not be showing you how to use them, but that's where that partnership with the police department to create a QR code and a place where you can go to watch for the instructions was really important. And so just making sure that that information was available from us as a health department. And then Gloria did all of the work to make sure that the staff was trained in the libraries.
And attending outreach events, the library staff go to outreach events throughout the year, as well as our community partners. All those 42 different members on our gun violence intervention team attend a lot of community outreach. And I always talk about stronger together. We are stronger together when we work together, when we collaborate, when we partner. And it's really important to have a library presence at those community discussions, whether it's a resource table, a back to school night, a Department of Health community listening session, a variety of different festivals in the community, whether it's at a farmer's market. There's a lot of different places that you can go, a Department of Social Services resource table. So there's a lot of different outreach opportunities that are available in the community. And we try to tag team so that while one is available, we decide who's going to bring the gun safety locks. So that's been really important. And also capturing those customer comments, those resident comments is helpful, not only so that we can share with our authorities who oversee us, the different boards, but also for the funding, to demonstrate there's still need and that this has been successful. So for the grant. So that's hugely important. And that's another best practice that we have developed or observed. Next slide. So ways the library can help. So I know a lot of library staff always think, okay, well, we can have the meeting room. The meeting room's available and we can post things on the bulletin board, but there's so many more things that we can do. Library staff, just like the health department, are very well versed in their communities. You know the communities that you are serving. And in a variety of methods, you know this. You may know about it from local meetings that you attend or boards that you serve on, community groups that you're a part of, you or your staff. You know your community that you're serving. You already have that advantage. And as we talked about earlier, have a stretch opportunity when you're part of a community meeting and you can see that there's a way the library can help. Raise your hand and say, we're happy to help with this. We can help you with this. We can partner with you to provide this aspect. Also, as we talked about before, the value of participating in outreach events, the traditional book and resource displays. On this particular picture on the right-hand side, this is called a soul box quilt, and it was provided by a group called Moms Demand Action. And there are messages on there of hope for the future. And also, they represent one life that has been perished because of gun violence. Other ways the library can help, there's a variety of different programs and events you can host. A couple listed here were the National Night Out and trauma training for the community in partnership with the Department of Health. We've just got a series of trainings that are coming up, and they're going to be held in different parts of the county and in the areas that have been identified as a community of hope in our county. So I think that that's important too. Next slide, please. Okay, and we have reached the end and the part where we ask you if you have any questions for us.
Well, first, I want to thank you to both again for coming to do this. I know we've been working on it for a little while, and I've just been so excited to finally offer it. And we have some support here from another NNLM program, which is the Public Health Department Collective, and they work with a lot of the public health departments. And so they were very helpful in getting some people here. So we have some public health people in the room as well as librarians. So I did just want to kind of recognize that. And they actually put a lot of the questions in the chat. And I think you might have touched on some of them, but I do want to go back and reread them just to be sure. I know that we talked about the gun lock safety working. So when you hand it out, then you just kind of give them the information that this is where you can find how to actually watch the instructional video. And, you know, the way the county's set up, at least for my end, I'm Glen Burnie, but I'm in between Odenton as well. And I guess they could also stop in the police station. Like on my side, we've got that one that's on Telegraph Road. Technically, they probably could just stop in there and say, hey, I got this from the library. I was over at Odenton. I picked this thing up. I don't know how to use it. Could you show me? I'm assuming that they would not turn them away. I mean, they probably would welcome that, somebody coming in. So
absolutely, they would welcome that opportunity. Yes.
Yes, and then we talked a little bit about the measurements, but there was a question here about, let's see, I'll read Christy's question comment. The public health data overlays correlations you mentioned. Can you speak to more about the outcomes you're measuring? They're kind of interested in childhood gun injury and suicides overall, those resulting from gun use.
Sure. So we, as the gun violence intervention team, if you go to the health department's website, we do have an active dashboard that we populate with information provided by our local police departments. So both Anne Arundel County Police Department and the Annapolis City Police Department. So we're able to track and report out on gun homicides and suicides. Sometimes the numbers are too small for us to report certain things. So we, in public health, for those of you who are public health folks, you know, if it's potentially identifiable because the number is small enough, then it's not something we can report out. So sometimes when you're looking at youth suicides and that sort of thing, we may not be able to report on it specifically because if there are only 3 or 4 in the county, people then know which child we're talking about. And so there's some data points that you may not find. Also, we don't necessarily draw a direct correlation, right? There are a lot of things that can increase or decrease gun violence. And so we hope that this risk reduction strategy is leading to less gun violence in the county, and we're definitely tracking it, but it's not something that I go out and say, hey, we think because we did this, we've seen gun violence go down, right? We know that we have to take a multifaceted approach, and we hope that a culmination of things that we're doing will lead to that, but we do measure quite a number of things on our website. And so you'll find suicides, homicides, where they're located, and we break things down. That data is disaggregated by race, ethnicity, age, gender, because we see different gun violence impacting different communities differently. So our highest rates of suicide tend to be in older white men. Highest rates of homicides tend to be in younger Black men. And then we're able to watch trends to know what's happening. We are seeing younger Black men with more suicides and more youth suicides. So we watch all of that internally, but how much of it we can report out sometimes really just depends a little bit.
Great, thank you so much. And Christy's given a thumbs up, so I think she's good with the question, with the answer. There was also a question around, and you mentioned some of this in the last slide, Gloria, around programming and other ways libraries could help, but the question is a little bit more specific is, do you offer, I guess, programming that would tie in with the gun lock distribution? So if there's gun safety education or public health gun violence prevention type of program? And if you did, how have they been received?
That's a great question. One of the things that we have done is we have served as a site for some of the community meetings that the health department has hosted, and also some of the training that the health department has hosted, the trauma training. And we have shared with the community that when these resources become available. We've also, for Gun Violence Awareness Month last year, we partnered with Moms Demand Action to provide opportunities for members of the community to come in to create soul boxes, and that was well received. That we did on a smaller scale. We just did that at Annapolis last year. But we have some of the soul boxes, the quilts, available in 3 of our locations, and they have actually rotated in locations throughout the county for the past year. Initially, we thought they would be in place for 1 month, but we thought they were so well received that we have transferred them in different parts of the county, and customers have been able to see them and ask what they are, and read about it, and it raises awareness. It's not just the box represents the life of one person who's perished. So it's that's been well received. This year we just did a new activity. It was very passive, but 15 of our 16 branches offered butterfly crafts for the community to write a message. A butterfly in many cultures around the world has been seen as for transformation, for change, for growth, for joy, for change. So we had customers write messages of hope, change, and whatever they wanted to write about for Gun Violence Awareness Month. And at the community meeting that was held in Severn this past Thursday night, we had about 20 adults that wrote messages of hope and to end gun violence that were listed on those butterflies, and we put them on display at our branches. So a passive activity for sure, but it's one that has been well received by the community. But we have not to date hosted a gun safety class. Thank you for the suggestion. Now we're going to pursue that and see how we can offer that to meet some needs of the communities that we're serving. So I appreciate the suggestion. Thank you.
Wonderful. And then there was a question about if you guys have any plans to publish papers on this project. I know you've done a lot of presentations for the state and done some stuff with the governor's office because I've seen it on the news, but I know I was talking to Gloria right before we started about, maybe even looking at something like Public Library Association. I know AHPA is coming up. It would be too late to submit to that, but people are wondering, are you going to do something later?
Yeah, that's a great question. And I'll speak from the health department side, and then like Gloria, we have been doing a number of presentations. So last fall, the health department presented at the National Research Conference for the prevention of firearm injuries. We're presenting in Denver, and I cannot remember the name of the actually Oregon, I'm sorry, of where we're going to present there. Honestly, it's a time thing. As I mentioned, there's one person in the health department right now, or 2, that have this title. And so actually taking the time with all of the other things that we're doing to write it, we would love to. We've discussed it. Just actually taking the time to stop and do that. So it's on our radar from a health department standpoint, but Gloria has also been presenting in the library, has been out and about sharing this information as well.
Yeah, Gloria, I forgot to mention you did Maryland, Delaware presentation, because here in Maryland, we often combine the 2 library association conferences because the states are so close and so small. So MLA, DLA, but you presented at that and talked about this program, correct?
Yes, myself and 2 other colleagues discussed the program at the May MLA and Delaware Library Association conferences. Well received. And actually also we received a request from Tampa, Florida, from the police department there, the sheriff's department, and they read about the program in, I think it was The Trace, which is a newsletter dedicated to gun violence and prevention and awareness. And they heard about the success from the health department and the library partnership, and they decided to reverse engineer this process and learn from our experience. And they approached the library there in Tampa in the city about doing this type of initiative. So, and in our own state, Talbot County, Maryland is also looking at launching this perhaps later this month. So word is getting out, which is good. We need to make our communities safe so that, you know, we can all thrive.
Wonderful. I'm just putting the evaluation survey link in here for people. But again, thank you all so much for thanks to you both for coming to do this webinar. I thought it was just such a cool program to see. It doesn't always have to be like super innovative, even though this is, but I wanted to make sure that we got this out in front of our audiences, ways to think about partnering with health departments that, they may have not done before, may not considered. And although this kind of came about, in this way for our health department people on here, you could very well just approach your library and say, hey, I heard about this, or, I know this is going on. Dr. Getting, I have a question for you. Even though you represent the county, has there been interest where maybe, the county and the state, but has there been maybe a thought that you could make it a statewide type of program that it could funnel up? Because, we've got some other big systems. PG is rather big. You got Baltimore City and Baltimore County, both relatively large systems here in our state. I just kind of wondered, since it is tied into the state health department as well, could this be bigger, even though your jurisdiction is Anne Arundel?
Yeah, that's a good question. I think it could be, right? We're one of the only local health departments kind of focusing on gun violence in this way right now, but just after the legislative session this year, the state health department now has developed or will be developing a center for firearm and violence injury prevention. I might have gotten that title incorrect, but I think that will mean a lot, that the state health department will have this capacity, and hopefully there will be funding and best practices and ways to share this. So I think there will be some ways for it to pick up. We've also presented to all the local health departments about this, right? So they're aware of what we're doing. A lot of questions. It always comes down to staffing and funding.
Yeah, for sure.
At the end of the day, but I think that's something to consider. And then while I have everyone, I do want to do another shameless plug for a partnership we have with our libraries and other partners, which is, as I saw someone mention Narcan in the chat, we have vending machines. The health department has come up with free vending machines, and our library partners were an obvious fit for one of the 7 vending machines that we have in the county that distribute Narcan, xylazine test strips, fentanyl test strips, and other health materials. So you can get a rapid COVID test kit, a mask, and we're still looking at what people would like in those, but we've been able to partner with the libraries and other institutions, the detention centers, senior centers, to have those. And so I think there's just a lot of creative ways to work together, and we are excited that they're always willing to do the next thing that we ask, or vice versa.
I think I've got a shot. I think I posted that on our social media a couple of months back. I'm pretty sure it's the back of Christine's head using the machine, but I wanted to post that in a social because it was like a news story that I had found somewhere, or that she had mentioned. And I saw that the library was going to be a distribution site for that as well. And I think that is another great partnership, because this program is really important, because libraries are often funding this out of their own budgets. When we have these ideas, oftentimes we're going to the director and saying, hey, I have this idea, I want to do this. Can you find money for me to do this? And so the fact that, you were able to do it with this grant and do this partnership and think about the library as the distribution site, really helps us to creatively think about, how do we do these things, or how do we approach our partners and say, can we do this, or are there ways to do this, especially if there's already funding that's available through the health department to kind of expand some of these programs. And I would also say too, that if you're on this webinar and we're talking about relatively large systems, but I think this is also a very great program for even rural systems, because again, you have a lot of land, you have still people that own guns as well. Gun safety is also an issue in rural areas as well. So, although this was in a mostly urban presentation, it's applicable to any community size. And Anne Arundel, for example, actually has a mix of urban and then like one rural branch as well. So But again, thank you guys so much. I know we're running short on time. I wanted to thank everyone for coming to this webinar today, and sharing with us and listening. And if you have any questions, feel free to reach out to me and I can get you their information if you didn't already get it. And again, we'll make this available on our YouTube for you to get at another time. So again, thanks everyone for